Hey ladies, it's Kim Bukta back again to do another video today. In today's video, I want to discuss when we should be checking hormone levels and if we should be checking them at all. Again, for people who've not watched some of my other videos, I am a physician assistant in orthopedic trauma, so not in women's health, but I have taken an interest in this just because I'm going through the perimenopause, menopausal transition. And I've realized there's just so much information out there. It is really hard to figure out, what we should be doing. So as I'm learning these things, I was getting asked so many questions. I figured making these videos would be helpful for women that I know and hopefully other women that we can share these with, so that they can learn as well. And hopefully it helps us all to age healthier and kind of figure out what we should be doing in our lifestyles as we're going through this perimenopause, menopausal transition. So today's video, like I said, I want to talk about hormone levels and if we should be checking these. Because again, I'm hearing so many women going to a lot of providers and getting huge panels of like different hormonal levels and spending thousands of dollars. And I'm just doing the research trying to figure out, is it worth checking a lot of these levels? Just because in the perimenopausal time, your hormone levels are all over the board. So they can be normal one day, they can be sky high the next day, they can be zero the following day. So that's why you hear people calling this the zone of chaos. And that's because, again, your levels are fluctuating everywhere. So if you check a level one day, it could look totally different the next day. So checking these levels are not very beneficial for providers in making decision making. Now, if you're just following them for your own curiosity's sake, that's fine. But again, your levels that you could check during perimenopause should not guide your treatment at all. Your treatment in perimenopause should be guided on symptoms. Because again, your levels are just everywhere. So a provider cannot make a decision on what your levels are for estrogen and progesterone. Now, that being said, testosterone's a little bit different because testosterone doesn't have these large fluctuations like estrogen and progesterone. Testosterone starts to decline, and if a provider is considering doing testosterone replacement therapy, they should be checking your testosterone levels because that should kind of guide their treatment, and they should be rechecking it once they get you on a treatment to make sure they're getting you in the physiological, like normal premenopausal testosterone levels. So testosterone is different. If you're going to go on testosterone therapy, you should be checking those levels before, and then you should be rechecking them when you're on the treatment to make sure they're getting you in the right dose range, just so that they're not too high, too low, that they're kind of hitting it right for you. So postmenopausal women, if we went in to get levels checked, our estradiol levels are typically below 10 picograms per ml. Your progesterone level would be below 1 nanogram per ml. So this is postmenopausal. Now, your levels postmenopausal can be beneficial to check because especially if you're going to do hormone replacement therapy. So when providers are treating you on these estrogen and progesterone levels, they don't really have to recheck progesterone because progesterone is just given to protect that uterine lining, to protect you from uterine cancer, not really doing symptomatic treatment. So the progesterone level is not as important to check, but the estrogen level can be helpful for providers to make sure you are adequately absorbing the estrogen to treat your symptoms. So on hormone replacement therapy, or I should say menopausal hormone therapy, because you're not actually totally replacing your hormones, so they call it menopause hormone therapy. They're kind of aiming for around 40 to 100 picograms per ml for that estradiol level. So that's when you're on the menopause hormone therapy. That level that providers would be looking for estradiol is between 40 and 100 picograms per ml. Now, again, they don't really check the progesterone levels, so it's not as important. They just have you on a dose to kind of have that uterine protection. Now, where it can be beneficial to check in when you're postmenopausal and if you're on this menopause hormone therapy is there is a newer study that just came out that there are 20% of women that don't absorb their estrogen patches. So if you're still symptomatic on your estrogen patch, it can be worth checking a level to see if you're actually absorbing it because you may need to change to a different treatment modality. So with this coming out that 20% don't absorb, some women are having to go to oral or gel sprays or different options. But again, that's where it can be beneficial to test in the postmenopausal range. Now, testosterone levels, again, if a provider is writing for testosterone, you should be getting a level checked to make sure that you are kind of in this pre-physiologic, like premenopausal range. So again, you're looking at around a 20 to 80 nanogram per ml range is what the physiologic dose is in a premenopausal woman. Now, for testosterone, a lot of providers, I mean, I had my sister tell me this, I've had other people tell me this, where they get these pellets. Pellets are not great for replacing testosterone because typically they're in for 3 months. You can't adjust a level. A lot of times they are aiming and they end up with levels that are in the men's range. So they're way overshooting what they need to be. And women have worsening symptoms and they can't do anything about it because you can't remove those pellets. So more often for testosterone, they're using like creams or compounded forms of it just so that they can follow your dose and make sure that your levels are correct. So perimenopause, again, not really beneficial to check your levels because they're all over the place. So again, if you're curious, you can check them, but it should not guide your treatment. Your treatment should be guided on your symptoms. Postmenopausal can be helpful to check that estradiol level because again, there are some women that don't absorb those patches, and that's what most of us are on, is the patch. So 20% of women don't absorb that. So it can be helpful to guide your hormone replacement therapy with checking those levels. And testosterone levels, they should for sure be checking if you're taking testosterone replacement to make sure you're getting it in that correct level. So again, hopefully this information is helpful. Again, I just know that women are spending thousands of dollars on lab tests, and I just want you to kind of know, like, is it helpful for guiding your treatment plan versus not helpful? So hopefully this information is beneficial. Again, if you like these videos, please share them and hit like and subscribe. And again, subscribe is just going to let you know when I make my next video. Doesn't mean you have to buy anything. I'm not selling anything. I'm just trying to, like I said, promote the information that I'm learning just to help women become more knowledgeable in this perimenopausal, menopausal transition. And again, trying to help sort through the noise because there's so much information out there. So again, hopefully you like these, and we'll just keep making videos to hopefully help educate us. Thanks, ladies. Until I see you next time.